And I will turn to, is it Senator Kaine?
Thank you, Senator Murkowski, and thanks to our witnesses for being here today. Dr. Monarez, I owe you an apology. When you were here for your confirmation hearing, I questioned you very significantly, not on your qualifications. You got over the qualifications bar easily, but my worries about the direction of HHS made me question you very significantly on your backbone.
You did?
A trait that is not in long supply in this town. And then when I voted against your confirmation, I cited that as the reason. Again, no concern about your qualifications. I had concern about your backbone, and I was wrong. And I apologize to you for being wrong. I think it's important when you're wrong to admit you're wrong. I want to ask you a question to follow up on an answer you gave to Senator Baldwin, and I'm not sure I heard it right, but were you instructed by the Secretary of HHS to not speak to senators?
I was instructed to not speak directly with senators.
And was that also in the August 25th meeting you described?
That was over the course. I had several engagements with the Secretary over that day, and it was in one of those meetings that I was instructed.
So confirmed CDC Director, Senate confirmed. We used to speak with the CDC Director all the time during COVID and during other emergencies, instructed not to speak to senators. Isn't it, is my memory right? Doesn't Secretary Kennedy say he's about radical transparency?
That is one of the areas he has prioritized.
Yeah, well, putting a gag order on a CDC director and directing her not to speak to those who have confirmed her and to whom she is responsible for oversight is a very serious matter. I want to talk about measles and finish with a question for Dr. Horry. Just really get in the minutia about measles. 1,454 cases in the U.S., 4 in Virginia. And I'm just going to give you about the most recent one in Virginia. School-age child, early September, 5 to 12 years old. Measles is really contagious, spreads through the air. You can contract measles when somebody has had it in a room, even 2 hours after they've gone from the room. Mm-hmm. And you often don't show symptoms for days. When this child with measles was identified and the case was reported to public health officials, our Virginia Department of Health had to spring into action. They had to find potential exposure. The child, while infected but before demonstrating symptoms, had attended school for 1 day and had visited multiple healthcare facilities. In 1 day, 1,000 Virginians were exposed to measles by this one child. The VDH coordinated with the healthcare community and the school district to contract trace 1,000 people, followed up with 800 people, including babies in a NICU too young to be vaccinated, had repeated contacts with these individuals to make sure that they weren't showing symptoms. The VDH has dozens of staff, about 50 were working on this issue. And within days of the knowledge of the case, the VDH had worked to notify all 1,000 people. Now they have to continue to monitor for another 21 days. 45 to 50 officials had to work just on this one case. I'm very proud of their work. And I'm sharing the background just so people understand how serious even one case of measles is. The Infectious Disease Society of America says the median cost for a health department to respond to one case of measles is $32,000. So just multiply that by the 1,454 cases this year, $46,464,000 already to respond to measles, which is at a rate that we haven't seen in a number of years. A case costs a median of $3,200, but the price increases as you're trying to contact trace. The median price to contact trace is $223. So for Virginia, just to contact trace 1,000 people, $223,000 for one case. I bring this all up because to make it even harder for states to respond, in March, Secretary Kennedy rescinded $11.4 billion in public health funding to states. To Virginia, our Department of Health lost $425 million during the worst measles spread we've seen in recent years. The money was being used to modernize the state's technology to allow it to better track and respond to outbreaks, to upgrade the state's epidemiology labs, and to support community health workers. 500 employees and contractors in Virginia have been laid off because of these cuts. This shouldn't be happening. Dr. Howery, did you or career scientists ever brief Secretary Kennedy about recent measles outbreaks?
We did not brief Secretary Kennedy.
Did you speak with any HHS or CDC political staff regarding the outbreaks?
With CDC political staff, absolutely. Our team did, like the chief of staff and our communications. about measles. And I did want to just follow up on your point about funding. That's my concern. 80% of funding of CDC goes out to state and local communities. So as we see budget cuts to CDC, your community will see that too. And the boots on the ground work that you did in Virginia is exactly the heart of public health.
Thank you. I yield back.